It's time for Morton in the Morning on WVBF, a weekly get-together with your friends at Morton Hospital. Coming to you every Wednesday at 11:05 a.m., Morton in the Morning brings you full access to the latest hospital news and health information. Stay in the know about important health and wellness topics, new doctors and services, and upcoming events, and get to know the team at your community hospital. And now, Morton in the Morning.
Good morning, everyone, and welcome to this week's episode of Morton in the Morning. I'm your host, Julie, and we are coming to you right here from Morton Hospital, your community hospital in Taunton. And we are here with you every Wednesday at 11:05 a.m. right here on WVBF, your hometown radio station. We hope you have been enjoying the encore presentations or shows that we have hosted over the last few weeks, but we are really excited to have a new show for you today. And we have a great guest here. We're going to be talking about the Speech, Hearing, and Language Center up at our Northwoods Medical Center, which is one of our outpatient departments here at the hospital. And we're going to speak about the topic of cognitive communication disorders and treatment options. So we have a great guest from our Speech, Hearing, and Language Center who is going to talk to us about that topic and what they have to offer there. But first, before we get into the interview, I wanted to share a couple of updates with everyone to kick off our show. So the first update I want to share is that this week we are celebrating National Emergency Medical Services Week, or EMS Week as we refer to it here at the hospital. So we want to give our sincerest thanks to all of our local and our regional and just any and all EMS providers in general, and thank them so much for all that they do. They are really an important part of our care team here. They are an extension of our emergency services department, and we just appreciate the life-saving care that they provide each and every day, and we are grateful to partner with them to care for our community. So thank you so much to all of our EMS providers in our community. We are celebrating them this week. We have done some grab-and-go lunches here at the hospital. We have special treats that we have in our EMS break room for them. And we're also delivering some gift items and some lunches throughout the week to the various stations. So happy EMS week. Thank you so much to all of our EMS providers. We appreciate you so much, and we are grateful for all you do for our patients and for our community. And the next announcement is an award or a designation that the hospital has received. We have been named a Blue Cross Blue Shield Blue Distinction Center Plus for knee and hip replacement. So Blue Distinction Centers are nationally designated healthcare facilities that show a commitment to delivering high-quality patient safety and better health outcomes based on objective measures that were developed with input from the medical community and leading accreditation and quality organizations. So facilities designated as Blue Distinction Centers for knee and hip replacement demonstrate expertise in total knee and total hip replacement surgeries, resulting in fewer patient complications and hospital readmissions. So we are actually a Blue Distinction Center Plus for knee and hip replacement, and only 10 other hospitals in Massachusetts share that designation with us. So we are so proud of our team for demonstrating the highest standards of care when it comes to knee and hip replacement. Thank you so much to our orthopedics team, to our surgical team, and all of our support areas that support our program. Congratulations on this designation. It's really something to be proud of, and we just want to share a shout out to our team and thank them for all that they do. So I have a few more shout outs and updates to share toward the end of the show, but because we have such a great topic today, I do want to jump right in and get into the interview and welcome today's guest. So today we have a very special guest. We love having staff that come and speak with us from our off-site locations because we have multiple of those. So today's guest is from our Speech, Hearing, and Language Center, and she is joining us from that team to talk about some important topics related to speech and language disorders. So her name is Breezy Bringhurst, and we're happy to have her. So welcome, Breezy.
Thank you.
So, tell us about yourself and what you do here at Morton Hospital.
Well, as mentioned, I'm a speech-language pathologist. I work at the Northwoods Medical Center with outpatients providing speech therapy services. I also work inpatient, seeing patients throughout the hospital for acute needs.
Okay. And elaborate a little bit more on the inpatient. So what types of, when do they have you come and do a consult? What types of patients would you see in the hospital?
Most of the patients I see in the hospital are people who are having trouble with swallowing. Either they've had a change in respiratory status and there's a concern that food or liquid are heading down the wrong pipe when they're swallowing, or they have some coughing while they're eating and drinking, they're not eating and drinking enough, or they've had a neurological change and the medical team need an assessment of their swallowing. Inpatient, I also do see people who have had a change in language or word finding after a stroke, or who have had changes in movement from Parkinson's and other movement disorders.
Okay. Now I know we have a full team as part of the department. So does everybody see inpatients as well? Does everyone rotate over here, or is just a select group of you that see inpatients as well?
Mostly there are 2 speech therapists who rotate between inpatient and outpatient. We have a few per diem, so there is a team of speech therapists for the hospital, but primarily there's myself and Kelly, the other speech therapist, who would see inpatients.
Okay. And is there a big demand for your services on site? I mean, when you're assigned for inpatients, do you spend the whole day here, or do you just travel over as needed?
Some days we spend the entire day inpatient, especially during the winter months when there's a lot of pneumonia, a lot of sickness, so we're very busy.
Makes sense.
So we have a full 8 hours of work to do, if not more.
Okay.
So sometimes we'll have 2 people in the hospital if needed. During our quieter times, we do sometimes split between inpatient and then go to the outpatient office for 1 to 2 hours, especially for after-school treatments.
Gotcha. So you can sort of schedule, your consults on site when it's not, a full day's worth.
Absolutely.
Okay. All right. So let's talk about the outpatient site, which again, you mentioned is at Northwoods Medical Center up on Bay Street. So we actually have a couple different outpatient departments up there. We also have our rehab services department, which is physical and occupational therapy. We have some x-ray and lab services up there. And then, of course, the Speech and Hearing Center, which has been around for quite some time. How long have you been with that team?
I've been on that team for 5.5 years.
Okay.
But there are speech therapists that have worked with the hospital for 25 to 35 years at this point, when the speech department was all on-site. But now that it's grown, we have inpatient, and then we have the off-site center with staffed with 5 different speech therapists.
Yes, and I know that you are very busy up there. So.
Yes.
So tell us about what type of therapy that you offer, because I know that you see pediatric patients as well as adult patients. So let's talk about what types of therapy is offered for adult patients.
Yes, so for adults, we provide treatment if someone has had a change in speech, language, voice, swallowing, or cognition, which would include memory function, attention, what we would call executive functioning, which is organizing yourself, planning, or getting through important daily events, including managing your medication or scheduling doctor's appointments.
Okay. So we're going to dive in much deeper and talk about those types of disorders, talk about the treatments that you offer, and also I want to get into how the families are involved in the treatment. But first, we do have to take our first break. So for our listeners out there, if you are just tuning in, today we are talking about cognitive communication therapy with Breezy Bringhurst, and she is a speech language pathologist out of our Speech, Hearing, and Language Center up at Northwoods Medical Center. So lots of great topics and helpful information to come, but please stay tuned and we will be right back after this short break.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
Need a primary care provider? Morton Hospital and Steward Medical Group have welcomed 3 new doctors to our community. Dr. Margaret Sywinska and Dr. Yelena Levin have joined our Steward Primary Care of Taunton practice located on Bay Street. For an appointment, you can call 774-501-3229. And Dr. Joanne Sylvia is now seeing patients at Steward Primary Care of Lakeville, seeing patients of all ages. For an appointment, call 508-947-4400.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning, everyone, and welcome back to today's Morton in the Morning show. If you're just joining us, we have a great show. I did share a couple announcements at the beginning of the show. This week we are celebrating National EMS Week, so thank you so much again to all of our local, regional, statewide, and across the country EMS providers. We appreciate you and the very important role that you play in our communities. I also shared that Morton Hospital was designated as a Blue Cross Blue Shield Blue Distinction Center Plus for knee and hip replacement. So congratulations and thank you to our entire orthopedic and surgical team and all of those departments that support those cases on that incredible designation. We are one of only 11 hospitals in the state to share the Blue Distinction Center Plus designation for knee and hip replacement. So today's show, we are talking about our Speech, Hearing, and Language Center, which is up at Northwoods Medical Center. We are here with Breezy Bringhurst, who is a speech language pathologist up at our center. And we are talking about cognitive communication therapy. And before we took the break, Breezy gave us an overview of the types of therapies that are offered and why someone might need those types of therapies. For example, if someone has some cognitive challenges as far as, getting through daily tasks, scheduling doctor's appointments, getting through the day-to-day planning, then they might benefit from the cognitive communication therapy program at the center. Now, I would assume that the family in those situations plays a big role, right? I mean, do a lot of patients self-refer themselves, or does the family recognize that something might be going on?
Both. The referral source starts with the primary care doctor or sometimes a neurologist or an ENT. So the client or the family member start by communicating any changes with their doctor. If a referral is needed to a neurologist or an ENT, that is completed, and then the patient is referred to us. So to start a referral, it's important to always call the primary care and ask for, if it's for cognitive therapy, for memory changes, asking for a cognitive therapy referral. And then, of course, at home, I encourage family members and clients to start using calendars and memory logs as much as possible to help support any changes in memory function.
Okay. Now, so often I think that sometimes we just brush things off. What are some things that you can tell, our listeners out there, what are some things to look out for, signs and symptoms that maybe your loved one is having this type of cognitive disorder versus just, having it's a fluke and nothing's wrong, because we really should pay attention to it.
Absolutely. So delayed word finding, if someone's having difficulty formulating their thoughts or thinking of the word that they want to say, or difficulty remembering recent events, those are 2 big indicators that there's been a change in cognition or language that warrant a conversation with a doctor. Also having trouble following daily routines, forgetting to take medication, frustration while speaking, and social withdrawal.
And so if they recognize that maybe like once or twice, should they just keep an eye on it? Like, what's the frequency that you would say that they really should contact the primary care provider?
I think the biggest take home is paying attention to how language and cognition are affecting someone's ability to complete daily tasks.
Okay.
If their ability to get through their day has been changed, that is the point where you absolutely should call call the primary care doctor. We all have a normal amount of moments where we forget the word we're saying and we say, I can't think of that place that we went for dinner the other week. It's not Applebee's, it's another restaurant that's similar, and somebody will chime in and say, we went to Chili's.
Right.
That's normal for everyone. But when it gets to a point where it's causing frustration or changes in daily routine, that is when we absolutely should be calling the doctor.
Okay. And I would imagine there might be some cases where the person that's experiencing these symptoms, maybe they're sort of in denial that it's happening. I mean, does that happen sometimes where you have a family who's concerned, they think something's wrong with their loved one, but the loved one is like, no, nothing's wrong with me, it just happened a couple times? How do you work with families on those types of situations?
So we try to keep all of the goals as functional as possible and communicate the benefit of coming in for speech therapy. We also keep every treatment task as patient-centered as possible. So, for example, if somebody's having difficulty with, what do they do in an emergency situation or with making phone calls, then we would specifically work on remembering loved ones' phone numbers, and we would role play making phone calls to make it something that the client can carry over at home, so it's meaningful.
Okay. All right, well, that's helpful. So let's talk about why someone might be experiencing these cognitive communications disorders. What could cause this to happen?
So the most prevalent causes are brain injuries, such as concussion or head trauma, stroke, dementia, also neurological disorders like Parkinson's. I also see people with cognitive changes that have been caused by prolonged illness or severe respiratory distress.
Okay. And now with things like a concussion or the stroke, do these symptoms typically come on like right soon after, or does sometimes are they delayed?
Usually with a concussion or a stroke, we see symptoms right after the event.
Okay.
We do often see clients a few weeks after a concussion or even a few months after a concussion to give them appropriate heal time.
Yeah.
But for changes associated with dementia or long-term memory changes, that tends to be a slow, steady change. So sometimes it can be hard for clients or their family members to identify, but really the most of the patients that I see are experiencing some level of frustration with communicating or remembering events throughout the day.
Sure, and especially with something like a concussion. I mean, I know concussions have gotten a lot more attention over the last few years because it's so important not to delay seeking care with something like that because it could cause long-term effects. So moral of the story is, right, if you think you have a concussion, you're experiencing any type of, delayed speech or difficulties, you should definitely get in touch with the doctor right away.
Yes, the sooner the better, because heal time and good response to therapy is usually the most effective within 6 weeks of the event. People still make gains 3 to 12 months after there's been a change, but really that healing period is, and the access to therapy is so important right after there's been a change, if it's from something acute like a stroke or concussion versus long-term memory changes.
Okay, so we talked about how they would initiate a consult with the department. They should first consult with their primary care doctor because a referral is required, correct?
Yes.
Okay, so once they've set up an appointment, they're coming in to see you, what does that initial evaluation involve?
So we start by reviewing recent medical history. So any discharge summaries from the hospital that patients have or medical information that they want to bring in is so helpful. The more the better. If we have a good idea of recent medical changes and medical history, that's helpful. We discuss what the client's goals are for coming in for language or cognitive therapy. And then our assessment is meant to identify strengths and weaknesses. And we do that using some standardized tests that are similar to a questionnaire. And we also complete some communication activities that help us figure out where the client is right now with their memory and their communication skills. Evals usually last 1 to 2 hours, depending on the client needs. Before the client leaves the center, we always provide a written list of recommendations, including frequency of treatment and a home exercise program.
Okay. All right. So we'll definitely, we'll get into that a little bit more, what that looks like. But my first question, because the family is typically so involved with these types of disorders, are they able to participate in the initial consult as well as throughout the therapy?
Absolutely. We encourage family members to attend the initial eval and follow-up treatment as much as possible. At least 50% of the time we're asking family members to observe in our treatment room or observe in our observation room that's specifically for family members. And having a family member present is very helpful for carryover of therapy tasks and strategies at home.
Yeah, and does it often also make the patient maybe a little bit more comfortable with these sessions?
Absolutely, absolutely. It's helpful to have a familiar face. The family members are welcome to stay in the treatment room for us for some treatment activities. Others, it's helpful to have a one-on-one focus. So our observation room is the two-sided mirror where it looks like a mirror on one side and the family member can see us from the other and hear via headphone or just from listening.
Great. Okay. And I would imagine they'd probably give you some important input as well, because they are at home observing this person, and maybe there's something that is not noticed during the consult or during a session, or that the patient themselves doesn't bring up, that the family can be like, oh, I also noticed this the other day.
It is so helpful. It's one of my favorite parts of working at the outpatient center is having the setup where we have family members either in the room or in the observation room. At the end of each treatment session, we take about 5 minutes to talk with the family members to summarize treatment and talk about carryover of activities at home. Before the treatment session starts, we also check in with the client and the family member regarding any changes, any needs from any needs that they might have for us to help with specifically at home.
Okay, so they're definitely an important part of the care team then,
Yes.
I think, in these situations. So, so let's talk about the cognitive therapy, the treatment. What should patients expect throughout treatment? What types of tactics are used? Anything that you can provide some further explanation on?
Sure. So we work with clients to develop functional goals for improved word finding, memory, and attention that relate to communicating during daily events. For our clients who are diagnosed with memory loss, we provide family members with training to reminisce and start conversations that can help improve orientation and expression. I love using family photos and memorabilia to start conversations, which is often enjoyable for the clients and for family members. I've had a lot of success helping clients create their own autobiography or their photo album to review over their life, which not only helps with speech and language, but I often find an improvement in mood, affect, and reduced frustration during that type of therapy.
That's great. And that actually reminds me, years ago, we set up a similar type of room in our Elder Behavioral Health Services unit, and we had staff, bring in, different memorabilia, stuff, from, decades ago. And the idea is to trigger memories, and it's amazing what that room has done for some of these patients that are suffering from forms of dementia and memory loss. And they'll see something and they'll be able to tell a whole story and share a whole memory about it. It's just amazing. So you probably have those situations, and it's probably very rewarding.
Absolutely. It's one of my favorite types of therapy to provide. And you see the family members can see the improvement as well, in that maybe on the initial evaluation, I can work with someone who has a severe memory loss, and they're only able to give me, 5 or 6 vague sentences of information. But then once you start reviewing over a photo album with meaningful photos, then in one treatment session they can give me 20 plus statements and a few stories about their life. It's a very nice way to approach cognitive and language services.
Yeah. That's really great, and I'm sure, like I said, very rewarding work that you're doing. So thank you so much for all that you do and just the way that you're helping patients in our community. I do have some more questions for you, Breezy, but unfortunately it is time to take our second break because we're about halfway through today's show. So I hope our listeners will stay with us. We have a few more questions with Breezy and then some additional announcements at the end of today's show. So stay tuned. We will be right back after this short break.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
At Morton Hospital, we're proud to be nationally recognized for quality and safety. In addition to recently achieving the Gold Seal of Approval and accreditation from the Joint Commission, the Leapfrog Group has named us as a straight A's hospital for having received 5 consecutive A hospital safety grades since 2020. To learn more about our achievements and awards, visit mortonhospital.org.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning, everyone, and welcome back to the second half of today's Morton in the Morning show. Thank you so much for tuning in. We have a new show today and a great guest with us. We've covered a lot of great information, and we've been speaking with Breezy Bringhurst, a speech-language pathologist at our Speech, Hearing, and Language Center, which is located up at Northwoods Medical Center. And as Breezy mentioned earlier in the show, our speech-language pathologists see patients on the outpatient basis, but as well as see patients for inpatient needs. And we were talking before the break just about, how rewarding it is for the team to see the progress that patients make during their therapy. I mean, obviously with, ensuring we're protecting patient privacy, are there, patients that you just remember that had real breakthroughs? I'm sure you've had some very rewarding and probably some tear-jerking moments too.
Absolutely. Recently, I worked with a client and the spouse, and during the evaluation, I would ask questions like, what did you do today? And the response was, this and that, this and that, this and that. And that was the only language that I was getting, was just very vague statements. But then after asking the loved one to go through and pick out 5 to 10 photos from each decade of life, put them in order in a photo album, and bring that album into treatment, we then started going through the photo album, and each page, this client who was who was only able to produce very vague short sentences, was then speaking in full sentences, laughing, having a back and forth conversation, and became teary, saying, "Thank you so much for helping me. It's wonderful." It really is a rewarding experience.
That's great. And I'm sure you have hundreds of stories like that.
Yes.
So thank you for sharing. So let's talk about, treatment. How long does it last?
So we develop an individualized plan of care for each person, and it can start anywhere from 4 weeks to 12 weeks. But as long as the client is making progress towards treatment, we can extend that time period as needed to address specific goals. We always talk about treatment dates with the clients and the family members. So prior to the end of treatment, we've selected a discharge date. We develop an activity program so that the client and family member can carry over the therapy task at home. And our goal is always to provide short-term therapy services, so giving effective tools to communicate at home and in the community is a big part of our therapy services.
Okay. So what types of things are they asked to do at home when they don't have your support? I mean, it's just like physical therapy. You have activities or homework that you do at home, and you're asked to do these certain things. So what do you assign to your clients?
Yes. So we start by making a client-specific list of strategies that help make communicating and memory easier, whether that's keeping a memory log, rereading information, discussing important events with family members, or taking photos of events throughout the week to review to help recent memory. Based on the client's likes and dislikes, we also create a list of activities, for example, playing word games with family members, recalling new recipes, or enjoying an audiobook. We do come up with useful written exercises as a homework plan as appropriate. Some patients really respond well to activities like helping plan a trip or, as mentioned, sharing photos with friends and family members.
Okay, that's great. So this is a lot of great information. Thank you so much for sharing. And I sort of just want to recap and, close the loop on everything that we've been discussing. So, once again, if you could just summarize, when should someone reach out to their doctor if they notice that they're having some cognitive changes or if they notice that a loved one is?
So the sooner the better. If you're noticing that your loved one is having frustration getting through their daily routine, that is when to call and talk to the doctor. We want to make sure that communicating is fun and engaging. So if there is a change in one's ability to communicate their wants and needs, it's also very important to call the doctor sooner than later.
Okay, so we mentioned that the Speech, Hearing, and Language Center is at Northwoods. How do people get there? Hopefully many people listening are familiar with it because the Northwoods name has been around for a long time, but...
Yes, so the center is right off of 495. It's in the plaza with Wendy's and BJ's Wholesale.
Yep.
It's on Bay Street. So if you're familiar with Taunton, you're just heading north on Bay Street and you'll see the center on the right-hand side. It's in the Northwoods Medical Center with several other doctors, pediatricians, and Tufts Dental is there as well.
Okay, and where within the building are you?
We are on the lower level. We are at the physical therapies at one end, and speech therapy is completely at the opposite end. You'll see Tufts Dental on the left, and then you'll see our door labeled speech, hearing, and language center.
Great. Okay. So very easy to get to, obviously. And as you mentioned, the first step, call your primary care for a referral. But if people have questions, could they also just call the center just if they want to learn more? Are they eligible? That type of thing?
Absolutely. They can call the center if they have questions. If we do not answer the phone, please do leave a detailed voicemail. We're often with clients or on the phone with the doctor's office, so the voicemail is so helpful.
Okay.
With a number that's clearly stated twice if possible, so we can call back and get you the information you need.
Okay, great. And that number to our Speech, Hearing, and Language Center is 508-823-3050, and I'll repeat it again at the end of the show. So, Breezy, thank you. A lot of great information. I think this is very helpful to our listeners out there so that they can help to identify some of those cognitive changes in themselves or loved ones. And thank you so much for the really important work that you're doing along with the rest of the team.
Thank you so much. It's my pleasure.
Okay. All right, well, we want to thank Breezy again for joining us today. What a wealth of information, and someone who is obviously very passionate about her work, as is the rest of the team up at our Speech, Hearing, and Language Center. So thank you, Breezy. Thank you so much for teaching us about the cognitive disorders that you see and what the treatment options are. It's a lot of great services provided at our center, which again, as Breezy mentioned, is located at Northwoods Medical Center. It's up on Bay Street. The address is 2005 Bay Street, right up near 495. And our Speech, Hearing, and Language Center, along with our rehab department, is located in the lower level of that building. And once again, just to share the phone number there, should you have any questions, it's 508-823-3050. Again, that's 508-823-3050. You can also find more information about our Speech, Hearing, and Language Center on our website. So you can go there to find out, because they also have, again, hearing and audiology services. So if you go to mortonhospital.org, click on the services page and find more about the center and all of the different types of treatment options and, communication and hearing disorders that they treat there. I also want to acknowledge that it's good timing that we are having this topic today, because May is actually Better Hearing and Speech Month, and actually just last week we celebrated Speech Pathologist Day, and we brought some goodies and some treats up to our team to say thank you for all you do. So thank you again to Breezy, and thank you to the team at the Speech, Hearing, and Language Center. Give them a call if you have any questions. But the first step, as Breezy had mentioned, if you want to schedule a consult or get an appointment appointment there is to consult with your primary care provider so that you can get a referral to see one of the therapists at the Speech, Hearing, and Language Center. So it's almost time for our last break of today's show, but before we do break, I would like to remind everyone how you can contact us here at Morton in the Morning. So you can email us anytime at mortoninthemorning@steward.org. That's MORTON in the morning at STEWARD.org. So feel free to shoot us an email at any time if you have any questions about the shows, if you have any suggestions for future topics that you'd like to hear about, or if you just want to give us some feedback and let us know how you're enjoying the show. We would love to hear from our listeners as well, and we hope that you are enjoying the shows. Our guests are great. They have a lot of wonderful knowledge about the important services that we offer, so hopefully our listeners out there are also learning a lot and learning about our services here at the hospital. Another great way to keep up with what's happening here at Morton Hospital is to follow us on Facebook. So if you're already on Facebook, and you can just search for Morton Hospital, or you can type into your web browser facebook.com/Morton Hospital MA, and we post almost daily on our Facebook page and keep everyone updated about new doctors and services, the celebrations that we have here at the hospital, any updates, quality achievements, and a lot of staff recognitions. So please follow us on Facebook. It's a great way to learn in real time what's happening here, and you can follow what's going on inside the walls of the hospital if you haven't been here in a while. We have a lot of great staff photos that we share, and a lot of again, staff awards and recognitions. And in the later part of our show, I'm going to share some results. Every year we do an annual Top Doc Awards program, and we kick that off at the very end of March in recognition of National Doctors Day. And every year our staff at the hospital votes in various categories for different doctors that they think are the best fit for that category. So we've given out most of those awards. We still do have a few to give out, but I will share with you the results of those providers that we have recognized thus far after the next break. And many of those names may be familiar to our listeners. And then before we take our break, we do have one new provider who has joined us, which I would like to give a shout out to and make sure our community is aware. So Melissa Sylvia, she is a nurse practitioner who specializes in medical oncology and hematology. She has joined our medical specialists of Taunton team. So Dr. Christina Saliarali and Diane Horan, who is another NP over in that office, and they are located right across the street from the hospital at 91 Washington Street. It's the Liberty Medical Building, and they are up in Suite 301. So we welcome Melissa to that practice, and we're so thrilled that she has decided to join our team. And again, our medical staff is continuously growing. We're always welcoming new providers and specialists to our team to make sure that we are able to offer the services and treatment options that you need right here in our community so you don't have to travel. So welcome, Melissa. So it is time for our last break for today. Again, when we come back, just a few more announcements and shout outs that we will share with you. So we hope you will stay with us as we close out today's show. We'll be right back after this short break.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
Need a primary care provider? Morton Hospital and Steward Medical Group have welcomed 3 new doctors to our community. Dr. Margaret Sywinska and Dr. Yelena Levin have joined our Steward Primary Care of Taunton practice located on Bay Street. For an appointment, you can call 774-501-3229. And Dr. Joanne Sylvia is now seeing patients at Steward Primary Care of Lakeville, seeing patients of all ages. For an appointment, call 508-947-4400.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning, everyone, and welcome back to the final segment of today's Morton in the Morning show. If you're just tuning in, we had a great guest today. We welcome Breezy Bringhurst, a speech language pathologist with our Speech, Hearing, and Language Center team. And we talked all about cognitive communication therapy and various cognitive disorders, how to identify those in yourself and loved ones, and what the therapies and treatment options are that they offer at our Speech, Hearing, and Language Center. So Breezy did a wonderful job describing some of that and sharing some helpful information. And if you missed today's show, don't worry. We always post it online. You can find the shows, the Morton in the Morning shows, on YouTube, and we share those links as well on our Facebook page. So again, if you follow us on Facebook, just search for Morton Hospital on Facebook or type into your web browser facebook.com/Morton Hospital MA. That's a great way to listen to any shows that you might have missed, so you don't miss that great information that was shared. So thank you again to Breezy. And before we took our break today, I mentioned that every year at the hospital we do a Top Doc Awards program. And that is kicked off on National Doctors Day, which is typically held on March 30th. And what we do is we send out different categories and we ask staff to vote for doctors in those categories who they think is the best fit and that deserves to be recognized in those categories. And we always get a great response from our staff, and we have given out several of those awards, and we wanted to share the results of those with our community. We have shared some pictures and shout outs on our Facebook page, but for those who don't follow us, you might want to know about these as well. A lot of these doctors' names you might recognize. Maybe you're a patient of these doctors, and maybe next time you see them, you might want to give them a congratulations and a shout out for winning these awards. So, the awards that we have given out thus far for Physician of the Year, the winner of that award was Dr. Matthew Werger, and he is a member of our orthopedic surgery team. So congratulations to Dr. Werger, very well deserved. Our Best New Physician Award, that was given to Dr. Rajeswa Sarasam, and he is our new hospitalist chief who has been with us now for a few months here at Morton Hospital, and he has just fit in so nicely and the staff works so well with him, and he is leading the hospitalist team here at the hospital and caring for our inpatients who are hospitalized here. So congratulations to Dr. Sarasam. Great new addition to our team. We're so happy to have you, and clearly our staff have enjoyed working with you as well in order to recognize you for this Best New Physician Award. Our Staff Favorite Award, that goes to another member of our hospitalist team, Dr. Daniela McCooey. Congratulations, Dr. McCooey. And a third hospitalist won an award here at the hospital as well, and that is Dr. Walter Diddle, another hospitalist here, and he took home the category of Best Sense of Humor. Now, a few others to share. So actually just this week, we recognized our Most Team-Oriented winner, and that one goes to Dr. Imad Bahati. He has been a member of our medical staff for many, many years. Very, very well respected both here at the hospital and within our community. He specializes in pulmonary critical care as well as sleep medicine, and this is definitely a well-deserved one for him. He is just a very essential member of our team, works so well with all of our departments, and we are grateful to have him. So congratulations to Dr. Bahati. For our Most Innovative Award, we actually had a tie this year, and both of these providers are so well deserving. I don't think there'll be any surprise here about why they won this category. So for Most Innovative, Dr. Herschel McGinnis, who is an interventional radiologist. He's also been with our team for many, many years. He is just on the cutting edge of, radiology services, and he's always bringing new ideas and for treatment options to make sure that care is kept here in our community. So congratulations to Dr. McGinnis. And sharing that category with him is Dr. Leonardo Batista, who is our chief of our psychiatry and behavioral health department here at the hospital. He's been with us for a few years now and was really a wonderful addition to our team and has helped us grow our psychiatry and behavioral health services here at the hospital exponentially. I mean, we have added several new providers. We brought in new treatment options such as ECT, which is electroconvulsive therapy, and he is just always thinking of new treatments to be able to bring into the hospital to address the growing demand for mental health care here in our community. So congratulations to Dr. Batista and Dr. McGinnis for bringing in the most innovative category and always being so forward thinking, and again wanted to keep care in our community and offer the best of the best in terms of care in your areas. And then the last award that we have awarded is Most Morton Spirit. And this one has actually been taken home by the same person year over year, and it's no surprise, and he is obviously very well deserving. He is a huge advocate for Morton Hospital, one of our biggest cheerleaders who has been with the hospital for decades, and that is Dr. Charlie Thayer. So congratulations, Dr. Thayer. Such a great fit for that category, and thank you for all you do to support and advocate for Morton Hospital each and every day. So we've got more awards to present. We have 2 or 3 more to give out in the coming weeks. So again, the best way to watch for those celebrations and recognitions is to follow us on Facebook. And then wanted to give a very special shout out and express our sincere appreciation to a member of our anesthesia team. Her name is Karen, and she is a CRNA, and at the end of this week, Karen is actually being deployed with the Army for nearly 400 days to support the operations of field hospitals. She'll be in Kuwait, where she'll be stationed, as well as Egypt, Qatar, Syria, and Israel. And she will be caring for injured service members and teaching the field hospital teams on surgical techniques and traumas. So Karen, we want to thank you so much for your dedication, for your sacrifice, and for your service. We appreciate you so much, and we look forward to your safe return back home. And just, again, thank you so much for all of your service, and best of luck to you, and thank you for the incredible work that you'll be doing as part of our armed services. And lastly, we had another hiring event here at the hospital this week. If you missed it, don't worry. We have plenty more hiring events coming up, but you can also apply online at any time at jobs.steward.org, and you can search for all of our open positions there. We have many. We're offering sign-on bonuses for some positions, including RNs, CNAs, nursing assistants, and unit coordinators. So that's a great opportunity there. So please spread the word. We are hiring here at Morton Hospital. We have lots of great careers available. Check them out at jobs.steward.org. Apply right online, and also watch for information for our upcoming walk-in hiring events, which we have been holding at least once a month lately. So more to come on a hiring event in June. Again, find it on our Facebook page, or we usually list those on Indeed. So that pretty much wraps up today's show. If you have any suggestions on health and wellness topics that you would like to hear about in the future on future shows, please give us an email at mortoninthemorning@steward.org. We are happy to take your suggestions and find some special guests that can speak to those topics that you would be interested in. And we want to give a huge thank you again to Breezy Bringhurst, speech-language pathologist with our Speech, Hearing, and Language Center team. She did a great job today, a great topic, and again, you can find all of our shows on our Facebook page and also on YouTube. So thank you so much for listening. We will look forward to joining you with more new shows in the coming weeks. And from all of us at Morton Hospital, we hope you have a happy and healthy week. At Morton Hospital, we're proud to be nationally recognized for quality and safety. In addition to recently achieving the Gold Seal of Approval and accreditation from the Joint Commission, the Leapfrog Group has named us as a straight A's hospital for having received 5 consecutive A hospital safety grades since 2020. To learn more about our achievements and awards, visit mortonhospital.org.